The next coming, the newer thing in orthopedics is avascular necrosis. So I have had two patients. I had follow-up for 2 years. All these the avascular necrosis, how it works is the basic pathology in avascular necrosis is you have loss of blood supply. So any loss of blood supply to the bone, the first reaction is an inflammation. As you all know, pathology, inflammation is defined as a tissue response to an injury. So a tissue injury is lack of blood supply. So the tissue response is inflammation in the femoral head. So once there is inflammation, there is always an edema. This edema further compromises on the sinusoidal blood vessels and further compromises. This is a basic pathology of avascular necrosis. So what does this HBOT do in the first? HBOT works only in stage 1 and stage 2, not in advanced cases. So Steenberg stage 1 and stage 2. So this is a patient, Mr. Suresh, bilateral avascular necrosis stage 1, no evidence of subchondral fracture, no evidence of degenerative changes. So this is after a month. It's still in stage 1. There is no evidence of progression of the disease. The patient was totally pain-free by 20th day. This we had not given any drugs, just oxygen therapy. So how it works is the anti-edema effect of, anti-inflammatory effect of hyperbaric decreases the marrow edema. Thereby, once the inflammation in the bone and anti-edema, the inflammation and the edema in the femoral head decreases and the pain comes down first. Then it helps, the stem cells comes into play and helps to reform osteoblast activity occurs. Whatever is necrosed in the 2-year study has not increased, but that's still not resolved yet. So that is a question. So the same patient, we have followed him up for a year or so. Even after a year, there's no further progression, no further subchondral fracture. Normally in an AVN, by about 1 or 2 years, you'll see the subchondral fractures. It'll go on, the disease progresses to stage 2 to stage 3, and then it goes on to stage 4, and then they eventually land up in an total hip replacement. So if you look at even after 1 year, there's absolutely no progression of the disease. That is, whatever is necrosed, it is not further increased. The remaining bone is still normal. So this is the same patient. This is the MRI. I've done MRI after every 6 months, 1 year, 2 years. This is another patient, second patient. I had follow-up for 2 years. So this is follow-up by MRI reports. So even after 2 years, he has not had any, compared to that, there is no progression in the previous involvement. No evidence of femoral collapse, no evidence of degenerative changes. So this is the main thing which will slowly catch up, because I am alone shouting from the rooftop. It's still not reached the orthopedic population. So, but I've seen the patients by 20th day. I measured it on Harris hip score and Oxford hip score. If you look at it, by 10 months, by even 30 sessions, this I've had to do 30 to 40 sessions. 30 sessions, if you see the Harris hip score, it's 90, from 38 it has moved on to 95. Oxford hip score is 59 to 60. Almost they recover the pain relief by about 30th session, and it goes on to maintain that even after 1 year, 1 or 2 years. And if you see the MRI reports in these two patients, it's the same as what it was before. It has not increased, and they're back to normal activity. So the next most important thing